Hey, this is Not So Complicated, presenting you on 5 minutes 5 high yield drugs, and this time we are doing gastrointestinal pharmacology. In this episode 3, we have included our omeprazole, ondansetron, metoclopramide, and loperamide, and infliximab. So without further delay, let's go. The omeprazole, it belongs to class proton pump inhibitor along with pantoprazole, esomeprazole, lansoprazole, right? So the uses are gastroesophageal reflux disease, peptic ulcer disease, Zollinger-Ellison syndrome, and also in H. pylori eradication in triple regimen, right? And the mechanism of action of this drug is that it irreversibly inhibits hydrogen potassium adipase pump in parietal cells and thus reducing gastric acid secretion, right? So the side effects are hypomagnesemia, that is due to decrease in absorption, and Clostridium difficile risk, right? And also osteoporosis with long-term use. And the USMLE pearl for this drug is that it is preferred for severe GERD over H2 blockers. Histamine 2 receptor blockers, it is preferred over those drugs in severe GERD, and you have to take 30 minutes before meals to ensure the maximum absorption of the drug. And example case is that a patient with heartburn and H. pylori gets omeprazole in triple therapy. The other drug we have is ondansetron, and it belongs to class FST3 receptor antagonist, serotonin receptor antagonist, and the uses are in chemotherapy-induced nausea, CINV, is in nausea or vomiting also, is in cisplatin therapy, right, and also in post-operative vomiting, POV, and gastroenteritis. The mechanism of action of this drug is that it blocks serotonin receptors and chemoreceptor trigger zone. Chemoreceptor trigger zone is actually present in brain in area prostema, and it blocks those receptors in that region, and also in GI tract, preventing emesis, which is vomiting, right? And the side effects are QT prolongation. QT prolongation is seen in ECG, and also headache and constipation can be present. The USMLE pearl for this drug is that it is first line for chemotherapy nausea, and also we had to check ECG in cardiac patients because it had a side effect of QT prolongation, right? And the example case is that cancer patient on cisplatin receives ondansetron to prevent vomiting. The other drug we have is metoclopramide, and it belongs to class dopamine D2 receptor antagonist, and also it is a prokinetic drug. So the uses are in gastroparesis, nausea, gastroesophageal reflux disease, and postoperative ileus. And the mechanism of action of this drug is that it enhances acetylcholine release, thus increasing motility, gastrointestinal motility, and also it blocks D2 receptors to reduce nausea. And prokinetic action is by enhancing the release of acetylcholine, right? And the side effects are extrapyramidal symptoms, that is tardive dyskinesia, hyperprolactinemia, and also pseudo Parkinsonism, it caused that, and also muscle dystonia is the side effect. So it is contraindicated in Parkinson's disease, and also black box warning should be given for tardive dyskinesia. This is the USMLE pearl for you. You have to remember this at any cost. So the example case is diabetic with gastroparesis, uses metoclopramide to improve gastric emptying. The other drug we have is loperamide, and it belongs to opioid receptor agonist, that is in peripheral, and also the uses are in acute and chronic diarrhea, and also in traveler's diarrhea. But it must be contraindicated in infectious diarrhea, as in severe diarrhea like cholera, dysentery kind of things, amoebic dysentery, bacillary dysentery. It should be avoided for a reason that the infection can precipitate inside the gut. And also the mechanism of action is that it activates mu opioid receptors in gut, slowing peristalsis and also increasing water absorption. The side effects include constipation, abdominal cramping, and rare QT prolongation. The USMLE pearl for this drug is that it does not cross blood-brain barrier, so avoiding CNS effects. There are no CNS side effects of this drug, and also we have to avoid in Clostridium difficile diarrhea, as I have talked earlier, the same reason. The example case is patient with traveler's diarrhea, takes loperamide for symptom relief. The other drug we have is infliximab, that belongs to anti-TNF alpha monoclonal antibody. TNF is tissue necrosis factor. It is used in inflammatory bowel disease like Crohn's disease, ulcerative colitis, and also in rheumatoid arthritis. The mechanism of action is that it binds TNF alpha, reducing inflammation, and also mucosal damage in IBD. The side effects are infections because it is reducing the inflammatory mediators like TNF, which are supposed to fight the antigens, right? So infections are the side effects, as in TB reactivation, and also infusion reactions, and lymphoma risk is there. So USMLE pearl is that we have to screen for latent TB before starting, because as I have talked, it can reactivate the TB, and we have to monitor for opportunistic infections. So the example case is Crohn's patient with fistulas, starts infliximab for disease control. So that is all for today. Subscribe for daily doses like this. Thank you for staying with me.